Sorry, I just realized my microphone was not on. God damn it. Okay. Anyways, hello there, friends. And today we're gonna be doing something very special. Welcome to my surgery squad. Yep. And today we're gonna be doing some operations. So let's go. Okay. First one, carpal tunnel release. You having problem with carpal tunnel release? It's no problem. I'll fix it for you. Okay. What now?
Welcome to Surgery Squad's virtual limited open carpal tunnel release surgery. I'm Dr. Jeff, and I will be guiding you through the procedure today. Carpal tunnel syndrome is characterized by a tingling numbness or pain in your hand and sometimes forearm. It develops with the wrist anesthetized. With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet around the patient's upper arm. Can you go ahead and outline where we'll be making our incision?
Of course I'll make it. Just a little dick. Right here. Looks like a swerve. Okay, anyways. Little bare ass. This looks like ice. But anyways. Then a what does it look like? A Oprah Winfrey. No, it's not what you thought. No.
Looks good to me. We'll be making a 3/4 inch incision at the intersection of those lines. Now take the scalpel and make the incision.
I can do everything. Oh.
Nice. I couldn't have done it better myself.
Yeah.
Now we'll spread the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems. Place the retractors into the incision and spread it open. I think you're a natural at this. With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place.
No, I don't want it.
Once it's in position, you'll advance our special knife down the guide to split the carpal ligament. As you push the knife forward, you will feel it cutting through the carpal ligament.
We glued it. How cool is... Oh, yes, go deeper.
Perfect.
Go deeper.
With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision. Go ahead and irrigate the wound. When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand. Great. Now you'll close the wound using non-absorbable sutures.
God, Jimmy, you see his arm got red. He doesn't feel it, but oh yes, the rope is white, but it turns
With the
out
wound
to be
closed,
black.
we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Okay. Oh, okay. You may feel a little pain, but it is not.
And lastly, we'll place a small dressing over the wound to absorb any residual blood.
Oh, you're going to put a bandage on.
We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover.
Very beautiful.
Our patient needs to... And that's a limited open carpal tunnel release surgery. Thanks for...
Now go a little... Okay, Okay, we have adenate there. Before you scrub in, okay, let's just wait. Perfect.
Hello, and welcome to Surgery Squad's virtual Our adenoids are We'll need to use a general anesthetic for our patient. Why don't you help out? Can you find a suitable vein in the patient? Looks good to me. Sterilize the injection area.
Yes, put it. Just pull it. Oh, now it's clean and pure.
Insert the needle and advance the angiocatheter into the vein.
This is the most boring thing I've ever seen.
The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed.
God damn it, yes. God damn it.
Now that the needle has been removed, I'll dispose of it in a sharps container. We need to secure the IV with tape and test the line.
Oh, yes.
Great! Now we'll wait a few minutes for the anesthetic to take effect. One more thing. Since we'll be working in the patient's nose and mouth area, we'll need to make sure he can breathe. Let's insert a breathing tube into one nostril.
I can show that.
Great job! Our patient is under and breathing. Now we're ready to remove the adenoids. We'll begin by putting an endoscope through our patient's nose so that we can view our work on a monitor. When we reach the back of the nose at the entrance to the throat, we'll be able to see the adenoids. Okay, good. Now we can see the adenoids. We need to open the mouth and get the tongue out of the way so we can begin our procedure. To do that, we'll use a special retractor that opens the mouth, depresses the tongue, and locks into position.
The mission. Oh yeah, there's the mask.
Great work! We're going to remove the adenoids using a device that uses suction cautery. The device uses electrical pulses to liquefy the adenoid, then suctions the liquid.
What the fuck is happening? Why the fuck would you do this? Oh yes, you burn it. Burn it all, bitches. Burn it all. Burn it all. Just burn fucking all. Burn it all, yellow bed. Burn it all. Burn it just like out of it. Come on. Take it away. Take it. Take it fucking away. God damn it, take it. Is this all I have? What is it? Like a skin? Oh gosh, this is so beautiful. I'm enjoying the thing.
Fantastic!
Oh, yes,
The adenoids are gone. Now all we have to do is remove all of our equipment and get our patient to recovery. Our patient is in recovery, and he'll be able to go home in a few hours once he can breathe easily, cough, and swallow. We'll prescribe some antibiotics, and once he gets home, he needs to drink plenty of water to keep hydrated. He'll also need to stay away from solid foods, but he'll get to eat ice cream, sherbet, popsicles, and jello for a couple of days. He might experience a burned taste in his mouth, which will subside after a couple of days.
That's fucked up. Okay, I think we're done with today. If you like that video, make sure to... Okay, I'll ask you just like the video. Drop a like if you want. And yeah, see you soon.